This is not an easy subject to talk about because it's about a crisis in health care, substance abuse, and mental health. All have become catastrophic problems in this country, not just in cities, but in rural America as well, on farms and mountain communities, and right here on the west coast of Florida. The good news is professionals are at work 24 hours a day, successfully treating people with mental illness and substance abuse, particularly opioid abuse. Progress is being made because of highly specialized treatment programs right here on the west coast of Florida because of an organization called CFBHN. It stands for Central Florida Behavioral Health Network. It's a management organization, and it oversees more than 100 treatment programs in 14 counties. And with us now is Linda McKinnon, President and CEO of CFBHN, and then Dr. David Clapp, the Chief Clinical Officer of CFBHN. Welcome to you both. We appreciate you being here and help us deal with this complicated subject here. Let's start with this, though. Linda, tell me about this. You are a managing entity. What does a managing entity do?
Well, and people ask that all the time.
Yeah.
What we do is we work for the Department of Children and Families in the state of Florida to assure that there is a safety net of behavioral health, mental health, and substance abuse treatment and prevention services throughout the 14 counties that we serve. That is sort of the global answer. We contract with about 100 provider agencies that actually provide those services to our communities. And then we're also responsible really for working within our communities, with our counties, our local legislators, stakeholders, to assure that the services that we're providing meet the needs of that particular community.
You're a great big organization. You've got a lot of people and you've got to communicate with all of them. That would seem like a really difficult job, is it?
It's time consuming.
I bet.
I affectionately say we're road warriors. We're on the road almost every day, meeting with constituents, with our providers, and really getting to know the communities and the people and what services are necessary.
Tell us about the vision for your organization. You've got such an incredible responsibility here dealing with all levels of people with really serious issues here. How do you see the overall vision of who you are?
Yeah, our vision is really to assure that there is a responsive, high-quality network of mental health and substance abuse treatment within all of our communities, and that the services that we provide enhance the lives of the people we serve and also the other people in the community.
Well, let's talk about the opioid problem. And David, the more I read about this, the more depressed I get about it because it's really overwhelming to a large degree. And I see it started when doctors started prescribing opioids, medical treatment, medications, and then it got out of control. What happened here with it? How did it become such an issue?
That's a very complicated question.
I know it.
And you've probably seen a lot of articles in the paper, TV shows about how the drug companies were actually misinforming their physicians about these opioids and about how they were non-addictive, that they were a great alternative to traditional pain management.
Did they just not know?
Well, that's in the courts right now about whether what they did or did not know. There have been some rulings on some lawsuits around that, but the emphasis right now is on what do we do about it now, which is we have a lot of people out there that have gotten introduced to these opioids. They are addicted. It's become not only just a prescribed drug now, but almost a street drug, and it's spread out to the general population and is affecting our community in a very big way.
You know, we hear the word opioids a lot. You might break that down for us. What are opioids? What are we talking about here?
Well, opioids is a class of narcotic that affects your mood, your functioning, your frontal lobe. It's very addictive very quickly. And with the fentanyl, you may have heard the fentanyl being added to the heroin and to the opioids. Yeah. They're cutting it with it. It's deadly. It's deadly sometimes on the first time someone takes it.
Now, am I right about this? We've gone from drug abuse in a general statement to opioid abuse, which is opium-based.
Correct.
That's where it all began.
It's not opium-based. Opium is the general name that they took the class of opioids from.
Okay.
Opioids many of them act like opium in that they have that numbing effect on the body, and were first, of course, used as analgesics.
And this addiction issue, it happens quickly, doesn't it? I didn't realize it happened so fast. You could be, a young person could be addicted before you know it in a matter of what?
Days.
Days?
Matter of your first time taking it. Yes, days.
So currently, for dentists and physicians, and a law was passed that now they're really only supposed to prescribe for 3 days or less. What they find is that the shorter the prescription, the less likelihood of addiction. But from 5 to 7 days, at that time, it exponentially increases the possibility of addiction.
This is a scary thing here we're talking about.
And unnecessary.
And unnecessary. That's the problem, isn't it? There is a medication. Let me ask you about this. When someone becomes, who's overdosed to the point of death, there is a medication for that. I mean, you can treat that.
Yes, there are.
With what?
Now,
Well, naloxone. Naloxone is almost like a miracle
What is it?
drug. Naloxone.
naloxone.
With an N.
Naloxone. See,
Sometimes
I want to know that one. That's a life-saving measure right there.
It is a
Is it
life-saving
new?
measure.
Is it brand new or?
It isn't new, actually. It's been around for a long time. It's now sold under a brand name of Narcan, is one of the other ways that it's known. What's new about it is that this epidemic has made it come to the forefront as a potential way to really bring people back from the dead.
So essentially, those medications have been distributed to many of our law enforcement, our first responders, the emergency rooms, and our treatment centers actually also give it to people who are in treatment, graduating from treatment, or their family members in case there is a slip and someone, because they're very, very at risk, somebody after they've been clean and it's not in their system and the tolerance has not been built up. So we distribute that and give that out actually to users of these drugs and their families themselves, because it saves so many lives.
So the important part here is to keep your eyes open, your ears open, know what you're doing, and anticipate some reaction here to medications. I can remember we didn't used to even think that was an issue, but now all of a sudden it exploded in our faces with opioid and mental health. Combine that and you've got a real problem here. We got much more to talk about, and we'll continue in just a moment after this.
Prescription opioids can be addictive and dangerous. Addiction can happen in as little as 5 days. Most opioid addiction begins with a legal prescription. It's time to speak out, opt out, and throw out. Talk to your doctor or your dentist to see what's right for you, and ask about the risk of addiction. Ask if there are alternative treatments. Learn how to safely use, store, and dispose of opioids to prevent addiction, because it only takes a little to lose a lot. Visit CFBHN.org for more information.
And with us now is Lynn Ulrey. She's the CEO of a Drug Abuse Comprehensive Coordinating Office, which is a mouthful here, but it's known as DACCO. And that's what we're going to talk about here, exactly what DACCO is and how it's such an important part of CFBHN. Lynn, just what is DACCO? You know, what do you do?
We're probably one of the largest treatment organizations that provide substance abuse treatment as well as co-occurring disorders for Central Florida Behavioral Health Network.
Right.
And we see probably 7,000 people a year in treatment, either in residential or outpatient treatment, as well as prevention.
You know, this issue is really a tricky one because a lot of people are skeptical about treatment programs per se. Do treatment programs really work?
Absolutely. Treatment works and people do get better, people get into recovery.
Over what period of time?
Oh, it depends on you. It depends on your motivation. It depends on how sick you are when you started.
And what role do you have in that recovery period?
We have the role from beginning to end as far as getting somebody into recovery and then supporting their recovery after they get there.
Now, how do you do that?
Well, when somebody comes in, we have an open door policy. So you come in today, you're seen today. If you have need medication-assisted treatment for opioid disorders, then you would actually get dosed today with a medication. And I think it's really important for us to recognize that it's an ongoing process, that the medication-assisted treatment does work. Detox does not work for opioid disorders. Detoxing somebody, 99% of the time they will relapse.
That's the big
So-
news now, isn't it?
Yes.
Detox is not what we used to know as a clarification or cleansing. That doesn't help now.
Not for this particular
Not for
drug.
this.
Right.
Not for this.
Right.
Tell me about this medication-assisted therapy, and that brings up an issue here that I think is interesting. Here you're having to treat people with substances because they're addicted to substances.
Yes.
How do you use a substance to treat a substance?
Well, they are partial agonist and full agonist, and those are really important medically, and it's important for the doctor to decide which one works for you. So there's an injection of Vivitrol, which lasts for a month. If you have no problems with your liver, then you probably can take that, and it actually is not an agonist or a partial agonist at all. It's just another medication. So that would be one option. Another option is buprenorphine or Suboxone. Those medications are usually taken sublingually. It's a film, and that is a daily dose of something. And then the last one is methadone, which is a tried and true gold standard.
Been
for
around a long
Been
time,
around a
hasn't
long
it?
time, and people actually do very well on methadone. You have to come to a clinic for that, so it's a little bit of a hardship. But some of the patients that we have may have been arrested, may live with another addict, don't have resources, recovery resources. And so when they don't have a job and those kind of things are going on, methadone may be the right medication for them to be sure that they're staying on track.
You know, it might help to know just who we're talking about. As who are the victims here of what age group? Male, female, black, white, what? Do you know?
Probably more Caucasians, Hispanics, people between the ages of 18 and 40. And lots of people, we have a wonderful relationship with our emergency room at Tampa General. When people come in and they're craving these drugs and having detox situations, they'll ask us they'll give a dose of Suboxone in the ER and then send them over to us for treatment. About 50% of the people actually make that transition. There are more people out there in the world that need treatment that aren't getting it, though, than we're seeing. That's what's really sad.
And it's all kinds of people, really,
All
are
kinds of
what you were
people.
talking about here. And I saw one sort of summary that said it goes from stay-at-home mothers to professional football players.
To pregnant women. We have lots
pregnant
of
women.
pregnant women that are on these medications.
Well, tell me about some of the problems you run into, the barriers of dealing with these individuals who have this horrible issue that they have to face, and they need all the help that you can give them.
I think probably the biggest barrier is the fact that lots of people aren't referring the people to treatment. We have primary care doctors that don't know that treatment's available or where to send people, and may know that someone has a habit or doesn't want to ask because they don't know where to send them. So emergency rooms have just gotten on board with us, and I think that's been exciting with St. Joe's hospitals as well as Tampa General. But our primary care doctors and our OBGYNs really need to be looking for this more than they are.
So it's taken some time to know how to get the word out,
Yes.
isn't it?
Yes.
Among professionals in
Yes.
particular.
Yes.
Let me ask you this. You've recently been appointed to a Governor DeSantis task force. Tell me about that, and how is that going to play into your responsibilities and what you're expected to do?
We've been meeting regularly every month across the state, and it was an honor to be obviously appointed to such a task force. The Attorney General is managing that, and my focus is on treatment, obviously. And some of the things that we're recommending will be heard by the legislature so that they will maybe make some changes this year in who can be a peer, who can be a person that reaches out to people that are having this problem, that have been through it and successfully beat it. That's called a peer, and that person really is helpful to someone who's going through the process. So working with improving the opportunity for peers, increasing treatment. The state's not invested in treatment. They've invested about $450,000 in treatment.
Really?
The federal government has invested millions, about $50 million in our treatment here in Florida. So I hope that continues because we have a lot more people we need to reach. And and the state legislature needs to maybe use some of the money they probably will get from the opioid lawsuit to help with increasing and improving the ability to treat folks in the state.
I hear a big educational process in the making here.
You're absolutely right. You're absolutely right.
You've got a big job ahead
Thanks,
of you here.
John, for
and you've
seeing
made a lot of
that.
progress too, I know that. Let's take a break and we'll be back with more in a minute.
Prescription opioids can be addictive and dangerous. Addiction can happen in as little as 5 days. Most opioid addiction begins with a legal prescription. It's time to speak out, opt out, and throw out. Talk to your doctor or your dentist to see what's right for you and ask about the risk of addiction. Ask if there are alternative treatments. Learn how to safely use, store, and dispose of opioids to prevent addiction, because it only takes a little to lose a lot. Visit CFBHN.org for more information.
All right, now I want to introduce you to somebody else who's an expert in this subject of both mental health and this abusive condition that we're dealing with opioids. Dr. Tonicia Freeman-Foster, project director of what's called Florida Healthy Transitions.
Yes.
Florida HT, I guess it is.
Yes.
What is Florida Healthy Transitions?
So Florida Healthy Transitions is a program that works with youth and young adults between the ages of 16 to 25. We work with young adults and youth who may have severe mental health challenges, or they're just not feeling like themselves, and they may also be using substances as well. Our goal is to engage with them and to find out what they're interested in doing with their lives, whether it's buying a car, buying their first apartment, or renting their first apartment, should I say, or just buying the next new pair of shoes. It's finding out what they are interested in and helping them create steps in order to reach their goals and helping them create an action plan for their life. So basically, we're using their voice and their choice to help them map out the next phase for their life.
You know, as a parent, I've discovered over the years, one of the hardest things is trying to get your kids to understand what you're saying, A. B, to listen to some experience that we may have as adults. In many of these cases, though, these kids are alone, aren't they?
Correct. A lot of them have aged out of foster care, or we have a lot that are living at home and they just don't have a relationship with their family. A lot of times the family has mental health or substance use history as well, and so they're kind of together but separate. And so we're working with them to say, it's okay if you want to go to college, if you want to go to a vocational school, and that may not be the history of your family, we can still help you reach your goals, and we have resources to help you reach your goals.
I guess the bottom line is, how do you prevent young people from getting involved in addictive situations here that they cannot manage? You've got a program, you've got many treatment programs here that are part of this big organization, but how do you, when you get right down to each individual, how do you do it?
I think each individual is unique, but I think some of the things that the underlying things that we've seen throughout is listening. That we talk less and listen more, and we learn what's going on in their community, what's going on with them at school, what's going on with them at home, and also teaching them and having them find coping skills for themselves. So instead of using drugs, I enjoy playing football, I enjoy watching TV, I enjoy going to the mall, I enjoy playing basketball, and how do we get you to do those things instead of doing drugs? It's having options. Healthy options.
Well, boy, you just raised a great question. How do we do it? How do you do it? How do you make it work?
I think having peers there is a huge thing.
Peers.
Yes.
Yeah.
So one of the benefits of healthy transitions is at any point in time, about 75% of our staff are young adults themselves. So they are young adults with lived and life experience who say, you know, I understand what it's like to be bullied at school. I understand coming from an environment where I can't talk to my parents, and here are some of the strategies that I've used. And so it's having them there to go to a college to pick up an application or to role play a job interview, and someone who understands what it's like to be a young person.
How about this, Tonicia? What would you say to a single mom, take an average case, how does she prevent, what can she do, what can she say that she's not already doing to prevent this child from becoming, this young person, from becoming addicted to some substance here? Is there some secret connection here that we haven't heard yet? Because I looked at a figure the other day that showed me that more than 700,000 people have died from opioid overdoses since 1999. 700,000.
I think solution is there's not one solution, first of all. And I think getting everyone involved, like we talk about, it takes a village to raise a child. That's true. So the things that we teach our young people, I'm sure we are not the first person to say that to them. It's just a different messenger at a different point in time where a young adult may be feeling differently about the subject. So I think getting other people involved, mentors, whether that's people in the community, at your church, at school, programs such as Healthy Transitions, where other people can surround this young person and really wrap around them and provide the same message, but using different strategies.
But when a child has not been able to develop a real relationship with parents, how do you crack that barrier?
That's a really interesting question, because a lot of times our young people are able to crack that barrier better than the parents. Because again, it's coming from a place that someone that understands, and that there's less stigma. Like, I understand, like maybe there was a time that I myself maybe have used drugs or thought about it, or I understand your experience. And so we're able to get them to open up. We also have groups each week called Bent Not Broken groups, where they come together with their peers and they do fun things. They talk about things, they watch movies, they have potlucks. And so creating that positive environment and place for them to speak amongst each other, and it's a place of trust, and it's safe, and you learn other strategies among young people.
Do you feel good about the progress that's being made?
Absolutely, yes. It gives me hope, and it's inspiring, and it creates optimism knowing that we're helping so many young people.
So you're on the right track here.
Absolutely.
Finally, but it's taken a long time to
Yes.
get here when you go back to the beginning of how this kind of went off course here with these medications. I just hate that it started that way.
Absolutely.
You know, it started with the professional community.
Yes.
Well, the big news today, I guess, is that there's not only hope on the horizon here, but there's treatment. Tell me about the most important treatment. If you had to single it out and have one issue to deal with directly, what would it be? The most important treatment of someone?
Well, I don't think there's one most. I think there's a combination. What we try to do is call a wraparound model, and so we will have individuals from the medical community there. We will have individuals that may be friends or family members, and again, it takes that community. It's a community approach of everyone coming together, working together, because I think where we sometimes go wrong is we separate that, and we separate mental health from substance use. We separate educational, vocational supports, and really we're dealing with an entire person, and substance use may just be one of the things they're challenged with, but we still have to deal with the other aspects of their life to really help them transition and become productive youth and young adults.
But you feel pretty good about the progress that's been made.
I do, absolutely.
All right, Tonicia, thank you very much. Dr. Tonicia Freeman-Foster, Project Director of Florida Healthy Transitions. And we've got more. Back in a minute.
Prescription opioids can be addictive and dangerous. Addiction can happen in as little as 5 days. Most opioid addiction begins with a legal prescription. It's time to speak out, opt out, and throw out. Talk to your doctor or your dentist to see what's right for you, and ask about the risk of addiction. Ask if there are alternative treatments. Learn how to safely use, store, and dispose of opioids to prevent addiction, because it only takes a little to lose a lot. Visit CFBHN.org for more information.
All right, David and Linda, before we wrap this up, let me throw a number out here at you. 24% increase in opioid deaths in Hillsborough County alone from 2012 to 2017. In 5 years, the death toll in 2018 is 280. We've got a crisis that I don't think a lot of people really understand here and what has to be done. You're right in the middle of taking care of it and making sure that those people who are addicted and who become so much a victim of this get their lives back together again. You need to be congratulated for the lives you've saved so far. Let me ask you, though, a couple questions here. In the coming year, exactly what do you have planned in terms of your overall vision here of who you are?
This is not something Central Florida or our provider agencies
Right.
can do alone.
Right.
And one of the things that we've seen is that our communities are really coming together. So we're working with law enforcement, who takes this very seriously, with healthcare providers, with the hospitals, with our local communities, with our community coalitions to address this issue. And really every single one of us needs to be aware, educate ourselves, talk to our legislators, talk to our communities, and get involved.
Support law enforcement.
With the naloxone dosing, you mentioned almost 300 deaths.
Yeah.
What the other side of that is, between the 3 counties in Hillsborough, Pinellas, Pasco, there has been almost as many doses of naloxone given out, saving just as many lives were lost.
I've got it's a difficult question for you to answer, but I want to, excuse me, I want to ask it because we didn't know that medications being prescribed by doctors in 2002 would become so addictive. Why didn't the medical community know that? Is there a simple answer to that, or
The drugs that came out were marketed, and actually I've read a lot of the scripts, because now these are they're in court right now.
In court,
But
yeah.
it was marketed actually as a safer alternative to things like morphine and the traditional drugs that were available at that time as painkillers. So for many years, doctors really did not know the level of addiction from these specific drugs.
didn't know?
Did not know.
We now know there's a lot of studies out that say that a combination of acetaminophen and ibuprofen is more effective for post-surgical pain relief than opioids.
It's a learning process, isn't it?
It's a learning process.
Tell me this, how can the public become more involved here? How can the public help you?
Well, I think first of all, as we said, they need to inform themselves. Parents need to take the kind of courses that are available and out there to show them how to evaluate if their child may be using drugs, to educate themselves, for there's so many ways that a kid can hide these drugs in their homes.
And if I can just say, and to know about the Good Samaritan law, that you can get over the counter at your pharmacist, you can get Narcan, naloxone. If you got a family member that you think may be into opioids and they may have an overdose, it's a good idea to educate yourself on this.
Yeah, Good Samaritan just quickly doesn't hold someone else liable for
No,
it.
and that's what's
decision.
so important for people, especially young people, to know. So if you happen to be in an atmosphere and someone overdoses, you can call law enforcement to come and save that person, and you will not be arrested.
Won't be arrested.
Well, Linda McKinnon, President and CEO of CFBHN, and Dr. David Clapp, Chief Clinical Officer. I wish you the best, and thank you very much.
Opioid overdoses kill more than 130 people a day in the U.S. alone. Addiction can occur in as little as 5 days. Talk to your doctor or dentist to see what's right for you and if there are alternative treatments, because it only takes a little to lose a lot. Visit cfbhn.org for more information.
We have been talking about something you need to know about and realize that these catastrophic issues that are affecting so many people in Florida and the rest of this country can be and are being treated here in Florida by professionals, thanks to an organization right here on the west coast of Florida that's making great progress. And this organization looks over the administration of more than 100 substance abuse and mental health treatment programs in Florida that are part of CFBHN, the Central Florida Behavioral Health Network. Thanks to our guests, Linda McKinnon, Dr. David Clapp, Dr. Tonicia Freeman-Foster, and Mary Lynn Ulrey. I'm John Wilson. Thank you for watching.